Hello, welcome again to the Platinum and Cell channel. My name is Dr. Ademola Adewale. Thank you for watching and thank you for subscribing. If you are new to this channel, please subscribe below and set your alerts on so you can receive new videos that come on every month. Over the past 2 to 3 weeks, I've received a lot of email requests wanting me to have a conversation about the prostate. So for today's topic, we'll be addressing the issues of the prostate. So let's get to it. What is the prostate? The prostate is a walnut-sized structure that lies right just above the rectum and just beneath the bladder. And it serves one sole purpose, and the purpose is to provide secretion that keeps the sperms lubricated. And that's all it does. However, though, as we age gracefully, the prostate goes through some changes. It either enlarges or it becomes cancerous. By virtue of its proximity to the bladder, most of the symptoms that you will encounter if you are having prostate problem are you may have increased urination, mostly at night. We call that nocturia. Nocturia. Additionally, you may notice that the stream of your urine is not as pronounced as it used to be. You may have frequent urination and urgency. You may have delayed urination in terms of trying to urinate and the urine is not coming out. You may have delayed time trying to stop the urine from coming out. Additionally, you may see blood in your urine. You may see blood in your semen. You may have blood with ejaculation or pain with ejaculation. So when you notice all these signs, that's telling you that something might be going on with your prostate or your bladder. So what is a prostate cancer? Prostate cancer is an abnormal growth within the prostate itself. And what are the data out there about the prostate? Well, if you must know, according to national cancer statistics, 1 in every 8 men out there will develop prostate cancer at some point in a lifetime. 1 in every 8 men will develop prostate cancer at some point in our lifetime. Prostate cancer is the second leading cause of death from cancer in men. Second leading cause of death of cancer in men. Additionally, in the year 2021, it's estimated that almost 240,000 new cases will be diagnosed. And of those diagnosed cases, about 35,000 of those will die this year. That's about 7% of the diagnosed cases. So 7% of the yearly diagnosed cases of prostate cancer will probably die this year. As we dig deeper into the statistics, we try to figure out, who gets prostate cancer. Prostate cancer is rarely seen in men less than age 40 years. However, though, in the past 3 decades, we've seen dramatic increase in prostate cancer diagnosis in men between the ages of 40 and 50 years old. As you cross the age 50, though, the chance of you being diagnosed with prostate cancer increases significantly. Men 65 years and older account for 60% of all yearly diagnosed prostate cancer disease, meaning that 6 of every 10 cases diagnosed every year are seen in men over the age of 60 years old. So who are at risk for prostate cancer? Well, it depends on your genetic makeup. So if you have a family history in first relative that have prostate cancer, if you're a man, of course, and your age plays significant factor into it. Additionally, ethnicity also plays significant factor into who gets prostate cancer. So let's look at the prevalence of prostate cancer. Well, when we talk about prevalence of a disease, we looked at the disease in the form of cases per every 100,000 population. So for African American male, the prevalence of prostate cancer is about 173 cases per every 100,000 population. For non-Hispanic white male, the rate of prostate cancer is about 97 cases per every 100,000 population. For Hispanics and Latinos, that rate is about 86 cases per every 100,000 population. What is apparent with this prevalence number is the fact that African American male tend to have twice the prevalence rate of prostate cancer. This is concerning. Additionally, it's noted that most of the African American males that are diagnosed with prostate cancer are diagnosed younger, between the age of 40 and 49. So this is also concerning. Now, let's look at the prognosis and survival if you were diagnosed with prostate cancer. In order to have this conversation, though, we need to know about the stages of prostate cancer. So we use two main stages to determine what your prognosis will be. Either you have a localized stage prostate cancer, meaning that the cancer is confined within the wall of the prostate itself. Additionally, we have the distant stage prostate cancer, which means that the prostate has extended beyond the boundary of the walls of the prostate itself. So what are the prognosis of this diagnosis? If you have a localized stage prostate cancer, your survival in 5 years is about 100%. In 10 years, it's about 98%. So if you're a man, 65 years or older, that's diagnosed with prostate cancer in the localized stage, that means by the age of 75, your survival is still 100%. That is good news. That means you will likely die from something else other than the prostate itself. Let's take a look at the distant stage prostate cancer. So if a man is diagnosed with a distant stage prostate cancer, the survival in 5 years is about 30%. 30%. That means if you are diagnosed with a distant stage prostate cancer, about 70% of the men in this category will die within 5 years. What is a 10-year prognosis for distant stage prostate cancer? It averages about 20%. So that means if you're diagnosed with a distant stage prostate cancer, that means in 10 years, about 80% of the men in this category will die. So this is concerning. That is why it's important for us as men to pay attention to our body and to practice the preventative medicine necessary to make sure that if we're going to have a disease, especially if 1 in 8 of us will get this disease, to have it diagnosed early and have the necessary intervention. So how can we prevent prostate cancer? There's really no significant way or ways to prevent prostate cancer. However, though, studies are showing that habitual changes such as diet, your nutritional status, weight loss, and exercise might be a modifying factor that might prevent you from getting prostate cancer. But the evidence is still way out there. You cannot really prevent it. However, though, there are things you can do to make sure that if you're diagnosed with prostate cancer, it's identified early. If I want to be diagnosed with prostate cancer, I'd rather have the localized stage prostate cancer, knowing that my prognosis is very good. So, what are the take home points for today? Or even before we get to that, let's talk about how do you get screened for prostate cancer? Well, we use two modalities mainly: digital rectal examination to assess the size and the structure and consistency of the prostate, or using prostate specific antigen. So this is an enzyme that the prostate specifically releases and tends to, go higher over time. So as we age gracefully, the number of the PSA tend to rise. However, though, a disproportionate rise in that number creates a concern. So that's why it's good to be screened. So the take-home point today is this: for every man out there over the age 40, you need to be screened. According to the American Cancer Society, screening is, stratified based on your risk factors. So men over 50 specifically should need to be screened almost every year with PSA and digital rectal examination, or every other year. For men in the high risk category, especially African American men that were often diagnosed between the age of 40 and 49. And ironically, though, when these men are diagnosed, they tend to have the distant stage prostate cancer. So it's imperative for every African American man watching this video right now, if you're over 40 years old, to make sure that you get screened. Get screened early and frequently. Get a digital rectal examination done. I know we have, shall I say, aversion to having a finger stuck in our rectum to assess a prostate. But what are the alternatives? So please take this to heart. The earlier the diagnosis, the better your survival. So as an African American male out there watching this, and you know you fall in the high risk category, get your diagnosis done. Get your screening done every year so that we can train the trajectory of your PSA, which is the enzyme your prostate specifically produces. Now, let's look on the brighter side. Over 3 million American male currently living and just fine with prostate cancer. And knowing that if you're diagnosed early, especially with a localized stage, your survival in 10 years is almost 99%, shoot, bring it on. So, but the most important thing though is make sure it's identified and diagnosed early. So if you like what you've heard so far, please subscribe to the channel, like the channel, leave some commentary. And if you have a specific topic that you would like for me to discuss, you can send an email to platinummenshealth@gmail.com. Platinummenshealth@gmail.com. My name is Dr. Ademola Adewale. Thank you for watching. Until next time.